Hello friends, welcome to Creative Medicine. In this lecture, we will learn about Digibind it is used to treat the digoxin toxicity. All are true about digoxin except digoxin causes bradycardia due to increased vagal tone. It acts by inhibiting sodium potassium ATPase in myocardial fibers. True, it is 95% plasma protein bound. See, 95% plasma protein bound is digitoxin, whereas digoxin, if you see, digoxin is only 70 to 80% plasma protein bound, whereas digitoxin is 95% plasma protein bound, primarily excreted unchanged in glomerular filtration. True. So this is the false statement. Sorry, this is the false statement. Next. Which of the following will reduce afterload except N-L-April, hydralazine and nitroprusside will reduce afterload. Propranolol decreases the inotropic effect. Thank you and thank you for watching.